Welcome to Dark Side of Public Health, with another new topic, mental health policy gap. Why partnerships matter. Imagine a world where millions of people silently suffer from mental health problems, yet the systems designed to help them remain fragmented. Hospitals work alone, communities struggle alone. Digital solutions operate in isolation. And the result? Nearly 75% of people in low and middle-income countries still have no access to mental health services. This is not just a healthcare problem. It is a public health policy gap. Today we explore a critical question. Can partnerships transform the future of mental health care? Number 2. The global mental health crisis. 1.5 minutes. Mental health disorders are no longer a hidden issue. They are one of the largest contributors to disease burden worldwide. Today, mental disorders account for about 14% of the global burden of disease. Depression alone affects hundreds of millions of people globally. But the real crisis is not just the disease. It is the treatment gap. In many countries, especially low- and middle-income nations, mental health services are severely underfunded, poorly integrated, and inaccessible to most people. As a result, millions of individuals live without support, diagnosis, or treatment. Let me tell you a story. Rahul is a young professional living in a rapidly growing city. From the outside, his life seems stable, a job, a family, a routine. But inside, Rahul has been struggling with anxiety and burnout for years. When he finally decides to seek help, he faces multiple barriers. The nearest psychiatrist is hours away. Therapy sessions are expensive. His workplace has no mental health support. And culturally, discussing mental health still carries stigma. So Rahul does what millions of others do. He stays silent. Rahul's story is not unique. It represents the reality faced by millions of people worldwide. Why does this gap exist? The answer lies in fragmentation of the health system. Mental health cannot be addressed by hospitals alone. It requires coordination between multiple sectors: healthcare systems, education systems, workplaces, community organizations, digital technology. When these systems operate separately, people fall through the gaps. But when they work together, something powerful happens. Across the world, innovative partnership models are already showing results. One example is the WHO MHGAP program, which trains primary healthcare workers to recognize and treat common mental health conditions. Today, MHGAP has been implemented in over 100 countries, helping millions receive care through primary health systems. Another powerful example comes from Zimbabwe's Friendship Bench initiative. In this program, trained community members provide psychological support through structured conversations in public spaces. The result? Studies show up to 50% reduction in depression symptoms and significant improvement in quality of life. These examples demonstrate something important. Mental health care does not always require specialized hospitals. Sometimes it begins with community connection and support. Technology is also transforming the way mental health care is delivered. Digital mental health platforms are expanding access in unprecedented ways. Through smartphones and online services, people can now access mental health screening tools, telecounseling, cognitive behavioral therapy modules, peer support communities. Research shows that 60 to 70% of users report emotional improvement through digital mental health platforms. For individuals who hesitate to seek help due to stigma or cost, digital solutions provide a critical bridge. But technology alone cannot solve the problem. It must be integrated into the broader health system. Beyond human suffering, untreated mental illness also has major economic costs. Globally, mental health disorders contribute to an estimated $1 trillion $1 trillion in lost productivity every year. Absenteeism, reduced work performance, early retirement, healthcare costs. These economic losses highlight an important reality. Investing in mental health is not just a health intervention. Mental health is not just a medical issue. It is a societal responsibility. The mental health gap we see today is not inevitable. It is the result of fragmented systems and missed partnerships. But the solution is within reach. By building strong collaborations across healthcare, communities, and technology, we can create a world where mental health support is accessible to everyone. Because in the end, partnerships do not just strengthen systems, they save lives.